It is my great honor to welcome Joe Biden, the Vice President of the United States, to the Cleveland Clinic Medical Innovation Summit. Last January, President Barack Obama gave our guests today a remarkable task. He was asked to launch what the President called a Cancer Moonshot. His mission is to achieve a decade's worth of advances in cancer prevention, diagnosis, and treatment in 5 years. This initiative has already begun a virtual reboot of cancer research across the country. The Vice President has brought extraordinary energy and dedication to this critical task. I had the honor of being at the White House last week to hear the Vice President deliver the Cancer Moonshot report to the President and the American people. In its first year, the Cancer Moonshot is forging new partnerships to catalyze drug discovery and development, harnessing the power of artificial intelligence to improve diagnosis, crowdsourcing data to guide cancer investments, and evaluating new treatments and reducing environmental risks. Most importantly, the Cancer Moonshot has catalyzed dozens of ideas, ventures, and collaborations in private sector, laying the groundwork for a new generation of cancer discovery and innovation. The Vice President's personal commitment and leadership has played no small role in creating this momentum. He has turned his personal tragedy into a benefit for millions. We are thrilled to have this very special guest at our summit. Please welcome the Vice President of the United States, Joe Biden.
Thank you very much, Doctor. Thank you for the introduction, for your leadership of this incredible institution, as well as sponsoring this important summit. It's good to be back in Cleveland, and although we're not at the clinic, involved with your clinic. Every fall for 14 years, the clinic has brought together top CEOs, investors, entrepreneurs, researchers, doctors, and so many experts to answer a simple question. How can innovation in science, medicine, and technology transform the healthcare system to deliver better care and to save lives? I know that question can be asked across the entire healthcare spectrum, but I'm here to try to answer it as it relates to our fight against cancer. And I don't presume to suggest I have all the answers. I've identified a lot of the problems, but I think we have some answers. As every family facing a cancer diagnosis does, our family, the Biden family, learned as much as we could about the cancer our beau fought from diagnosis to the very end. And what we learned from the world's best nurses, physicians, and researchers is that even if we couldn't save our son, the science, medicine, technology, they're all advancing faster than ever before, so that we will save your sons and daughters. But basically, the way I phrase it is, we've reached, I learned, an inflection point about 6 years ago. Let me explain. As little as 6 years ago, oncologists weren't working routinely with immunologists, virologists, geneticists, chemical engineers, biological engineers, and so many others that you are now, many of you in the audience as I speak. New technologies, new therapies like immunotherapy are targeting cancer cells by using our immune system. Some progress, a long way to go, but promising. But in doing so, in immunotherapy, if it works, and it does somewhere, we've had some successes so far, it does less damage to healthy cells, transforming many types of cancer into chronic and manageable disease when 10 years ago they were a death sentence. Because of technological advances in analyzing cancer genes and proteins called proteogenomics, we're closer than ever to understanding the Holy Grail: what causes specific cancers and how to attack them. Why does one treatment work for you and not for me? I know you all know these things. The public doesn't yet. And today, there's a recognition that by aggregating and sharing data of millions of patients, genomics, family history, lifestyles, treatment outcomes, by using supercomputing power that we didn't have 5 years ago, today we can do 1 billion calculations per second. And before, if you have a child in high school, before they graduate, we'll be doing 1 billion calculations per second. We can find new patterns and causes and successful treatments of cancer. As this conference knows probably than any other group of people that can be assembled in one room, the healthcare industry especially needs accuracy and forecasting, not soon but now. If we could gather data from multiple sources and merge it, allow correlations, a new McKinsey study report says we could guide doctors in diagnosis and treatments and boost productivity by 0.7% every year. The McKinsey report went on to say, and I imagine some from McKinsey is here, with the inclusion of big data analytics, the healthcare industry would generate $300 billion of value per year and lower healthcare costs by 8%. It matters, not just for the health of the American people, but the health of the system. When President Obama asked me to head up the Cancer Moonshot, and sometimes I wish we had given it a different name, because when John Kennedy went to the moon, there was one moon. We now know there are 200 cancers. In his State of the Union, he said Biden will be mission control. And there are a lot of skeptics out there. Maybe there still are. Maybe with good reason. It was, well, here we go again. Nixon already declared war on cancer in 1971. But when he did, he had no army. He had no resources. And he had, understandably, no clear strategy to win. But because of many of you in the audience, after 45 years of progress, of funding research, training scientists and physicians, treating millions of patients, we now have an army and very powerful new technology and tools that we can bring to bear. And the moonshot, I'm always asked by the press, what's the moonshot about? Well, it's fundamentally about two things, from my perspective. It's about injecting the urgency of now into this fight. Not tomorrow, not in 2 hours, now. And it's about changing the culture, coming up with a new strategy for this fight, not the strategy left over from 1971. The strategy we're following in all our institutions today, though, is equivalent to fighting the last war. Let me explain. The model of scientific breakthroughs for most of our history was the model of individual achievement. Jonas Salk creating the polio vaccine. There was little, if any, sharing among hospitals, researchers, and little ability to share when the first moonshot was declared. Rosalind Franklin didn't share her X-ray image of the double helix structure of the DNA with Watson and Crick. They snuck into her office and took a peek. Our funding model at the National Institutes of Health and National Cancer Center primarily followed the old model. Some of you guys and women don't like me saying this, but your young researchers and scientists understand it. We know now as we see everywhere, that collaboration is the key to innovation. Think Google, Facebook, Wikipedia, I could go on. But our systems are ill-equipped to reward collaboration, to reward team science, to give credit to everyone involved in a publication. This shift from individual institutions to collaboration and team science, in my view, is critical to the success of our fight against cancer. I don't know the science like you know, but I know bureaucracies, and I know how to knock them down. The President authorized me to head up a White House Cancer Task Force to reimagine the federal government's role in the fight against cancer. It's made up of the heads of over 20 cabinet and sub-cabinet agencies and White House policy councils. Everyone from the National Institutes of Health to the Defense Department, to VA, to NASA, to EPA, the White House Domestic Policy Council, National Economic Council, the Office of Science and Technology Policy, OMB. I charged each of them to find new partners within the government to advance research, to determine how to improve and accelerate their contribution to prevention, diagnosis and treatment of cancer, and to eliminate any roadblocks that exist at a federal level to accelerating progress. And for the past 9 months, I've traveled the country and the world, touching major nerve centers, not only here in the fight against cancer, but throughout the world, meeting with thousands of patients and their families, physicians, researchers, philanthropists, technology leaders, heads of state, even Pope Francis. At the UN General Assembly a month ago, we signed 10 memorandum of understanding with 7 nations. You can't sign with Taiwan as a nation. We signed with 3 of their institutions to share data and research relating to cancer. Earlier this year, we put together a first-of-its-kind Cancer Moonshot Summit with all the cancer stakeholders. 7,000 people from around the country met simultaneously. It was the first national collaboration ever. Out of that and additional work came another 70 new private and public actions that are underway in order to meet our mission of reimagining a system that saves lives. I understand leaders from IBM are here today. Your CEO came to us and offered Watson, its supercomputer, to partner with the Department of Defense and the VA, the largest hospital in the world. Now a veteran, diagnosed with cancer, getting his or her cancer genome sequenced or tumor sequenced at Walter Reed, and then Watson will search how specific therapies that would target that particular cancer, and Watson will provide recommendations to the physicians and tumor boards to use in choosing the right treatment. I understand leaders from Amazon and Microsoft are here as well. Both your companies have stepped up with the National Cancer Institute to use your cloud computing capabilities to store genomic data of tens of thousands of patients. That data has already been downloaded millions of times, and this is just in the last several months. And work streams met from this group every week, and the task force met every 2 weeks. And I committed to the President in January that by year's end, the task force report, a Blue Ribbon Commission report made up of outside experts, and a vision statement is what I suggested should be the course the federal government encourages for the next several years. Last week, I presented these reports to the President. In the end, the task force laid out over 50 actions, ranging from realigning research incentives to be able to move quicker and promote team science, to insisting that all these agencies share all the information they have with one another, breaking down silos that existed at the federal level as well that impede innovation and collaboration and progress. You can read all of them by going to the whitehouse.gov/Cancer Moonshot, but let me give you a few examples. The NCI Genomic Data Commons we launched this year with the University of Chicago brought together cancer sequencing data and related patient information from tens of thousands of individuals, growing toward millions. It's totally open source. Anyone can access it for their research. That data has already been accessed, and it's just been a couple months, over 5 million times. The reason this is so consequential now, in addition to the fact that the Human Genome Map didn't exist in 1971, in 1971 we didn't have the computing capacity to look at all this aggregated data. But we do now, and it holds enormous potential. But so much more has to be done. We're reducing bureaucratic delays to speed up innovation through the FDA Oncology Center of Excellence, which brings together the FDA cancer expertise to more efficiently review all cancer-related progress, from diagnostic devices to therapies. Here's the problem we're addressing. Science is generating, you are generating a plethora of potential products, diagnostic devices, and therapies. But different divisions of the FDA have different levels of oncology expertise. With this new Center of Excellence, all cancer products will be reviewed by oncology experts. In addition, the FDA is setting up one point of contact for any hospital, doctor, or therapist to request access to an experimental therapy to be used for what they refer to as compassionate use, last resort. We also transformed access to cancer clinical trials. You all know better than I do, only 4% of all the people diagnosed with cancer ever become part of a clinical trial, which may be the only possibility of saving their lives. Why? Previous systems weren't helpful. Most patients, even doctors, didn't know where to go. And it's a problem for drug companies because they don't have enough patients to generate research, find new breakthroughs, and deliver them to patients. So we engaged the President's Innovation Fellows, some of the brightest young minds from Silicon Valley, who've come to work for a year on rotation in the federal government to help us modernize. They work with the National Cancer Institute to develop a website that's as easy to use as if you're trying to find out what movie is playing nearby as you pick up your iPhone to determine it. Anyone can go to cancer trials can go to trialcancers.gov and type in real words like breast cancer or leukemia, a zip code, an age, to find the list of clinical trials near you or your loved one that previously you could not easily find. And all those oncology docs out there from Butte, Montana to other areas of the country, not near great institutions like the Cleveland Clinic, those doctors can find out what trials are available for their patients. This is about the urgency of now. In addition, we set up a blue ribbon panel made up of top experts, some of you in the audience, outside of government, from a range of backgrounds. Given an express purpose, I asked them to identify the scientific areas that have the greatest possibility for the earliest breakthroughs. One example, launching 3D Cancer Atlas, which can image and track tumors' development and responses to treatment. We have 2.5 petabytes of data, enough to fill 500,000 DVDs for 33 different types of cancer now. As I'm constantly saying to anyone who will listen, if everything is equally important to you, nothing is important to you, as my father used to say. Everything requires prioritization. And that's what the Blue Ribbon Panel has done. You can also read their report on whitehouse.gov/Cancer Moonshot. And finally, I was tasked by the President not only to reorganize the effort inside and outside of government, but to focus on what we can do going forward in the future. Last week, I presented a vision statement to the President that identifies key areas, like enhancing prevention. Look, when you think of prevention, everyone thinks of tobacco cessation and exposure to the sun and lifestyle habits. That's all part of it. But there's a lot more to it as well. Making the existing imaging technology available to neighborhoods and people who don't have access to it. People without health care, only something like 18 to 20% have access to it. It all relates to prevention, earlier detection, more likelihood, less consequences. There's an entire new range of research capabilities that go to early detection, from blood biopsies to, that's why we brought in NASA, by the way. Radiation. No one knows more about radiation in the world than NASA. Everybody, why did I bring in NASA? Well, they're figuring out how to use different types of radiation that would not do damage to healthy tissue. I know this is a huge priority for the Clinic University Hospital, and especially Metro Health, which sees most of the underserved vulnerable in this city. Dr. Cosgrove raised the importance of prevention during a roundtable on the moonshot that I convened at the World Economic Forum in Davos back in January. And through the moonshot, Dr. Cosgrove and many others have made sure prevention remains a top priority. In fact, I was in Cleveland in June at the Langston Hughes Community Health Center and Education Center, where I toured mobile dental units, screening for oral cancer in communities that are in need, like also mobile mammogram units that we have in Delaware and other parts. As you know, by some estimates, 50% of cancers could be prevented. And that, as I said, prevention falls into three categories: personal actions, lifestyles, avoiding risky behaviors, responsibility of the government and industry to reduce carcinogenic and toxins in the air we breathe, the water we drink, the soil we grow food in, and make available existing technology tools to communities, because we know, as I said, detecting earlier increases outcome likelihood. And fourth, outcome where there's potential for new breakthroughs in technology, entirely new diagnostic tools, non-invasive blood biopsies being the one that most people are working on. You all know the answer. There's markers in the blood that tell you whether or not you have or are developing particular cancers. So say you have a tumor in a place that's too dangerous to go in to excise. You can find the byproduct of that tumor in the blood, you can sequence that. And you can determine then the stage or malignancy of that cancer without being more intrusive. In cases where young people get colon cancer or other cancers, we can test the rest of the family for something called Lynch syndrome, a genetic condition that causes these cancers in young people. If you have the gene for the syndrome, instead of waiting until you're 48 years old to get your first colonoscopy before you can catch it, you do it when you're 18 years old or 14 years old. For a non-scientist like me, I find it absolutely incredible and exciting what you're all working on. Other areas I focused on in the vision statement were we're engaging more patients in research to increase the percentage of patients enrolled in clinical trials, cutting the time and cost of these trials, expanding criteria for those who are eligible to be in the trials, expanding access to care and cutting costs by reaching communities across the United States with the newest breakthroughs to our outcomes where they're not wholly dictated by your zip code. Forging a worldwide commitment to the moonshot. As I said, we've already signed 10 memorandums of understanding from Asia to the Middle East to Europe to North America to share more genomic and protein data on hundreds of thousands of patients. I might have been able to summarize more rapidly if I just quoted Dr. Brian Bolwell's, chairman of the Cleveland Clinic's Cancer Center, 6 major points. He says the 6 steps to achieving the President Moonshot include increasing federal funding for cancer laboratory research, which I promise you I will do this year because the only bipartisan thing left in the United States of America is the fight against cancer. And some of the, you think I'm kidding, follow me the rest of the week. But some of the leaders are Republican members of the House and Senate. 2, fund basic research screening for early detection. 3, open up access to state-of-the-art centers. 4, rationalize the cost of cancer drugs. 5, develop better coordinated care systems. Speed up sharing of electronic medical records. By the way, the President and I thought we were pretty smart when we did the Recovery Act. And again, he put me in charge of, Joe, just spend $840 billion in 18 months and don't waste any of it. Well, every outside report says we wasted less than 0.2% of that money. But in that, we not only wanted to keep us from sliding into depression, as the Chicago School of Law and Economics has acknowledged we did, but also change the way we govern. All of you had told us years ago that if we had electronic record keeping, we could drastically reduce costs, save lives, and improve care. Well, we put $35 billion in that Recovery Act. It ended up in 5 companies bidding for it legitimately, spending all $35 billion. We have 6 really great systems, none of which talk to one another. I'm Vice President of the United States. My son was dying. He was at Jefferson Hospital. He was treated at MD Anderson. They did the trial of 1. They weren't even sure it was a trial of 1. Anti-PD-1 and an adenovirus directly into the brain, to the tumor, requiring constant MRIs, get it back, but he wanted to be home near his children. So he's at Jefferson. You heard from Mr. Crine. His brother is my son-in-law, Dr. Crine, a leading surgeon in the Delaware Valley at Jefferson. You know what we end up having to do? Going in with his cell phone, taking pictures of the MRI to send to MD Anderson. There's no way to get them down. Can you imagine any other company in the world working that way? You badly need an innovation conference here. The Moonshot is about all of us doing our part. Cancer patients and survivors learning how they can access their own records and files and consider sharing that medical data with institutions in order to advance research and help patients. Researchers who receive funding for clinical trials, keeping their commitments where they do not now to make available immediately the results and failures of those trials. As I said, the President gave me authority over I suggested that he signed. From now on, the 60% of you don't share this data on time, you're going to get fined $10,000 a day. That's a promise. $10,000 a day. It's unconscionable. This information is not shared as required. It's been estimated that only 10% of clinical research studies are properly reported, which slows progress. It's counter to the urgency of now. Drug companies, some of you are here today, collaborating with us in the government to make treatments, some of which are incredibly costly, more affordable, more accessible, and explaining to us how one treatment that is life-saving, and there are more than one, is at starts off at $49,000 a year, and now is $125,000. Nothing's changed. I have a brother who used to actually $26,000 and $120,000. My brother has an expression, go figure. Well, we're going to figure. And most of all, the moonshot is all of us in this room who understand the urgency and the need to reimagine the fight for the 21st century. It's the spirit of discovery that defines this country. And it gives me every confidence we're going to make enormous progress. Those involved in cancer research are among the brightest, most dedicated, decent, committed people in the world. There's one other reason why I said what I said when I announced I wasn't running for president, is that it disturbs me that for the first time in my career, there are a lot of people in this country who no longer believe we, America, can do anything. Think about it, folks. I'm not talking Democrat, Republican, I'm not talking politics, I'm talking about the attitude of the American people from 25 years ago, 30 years ago to today, about what was within our wheelhouse, what we could do. Well, we can do virtually anything. We have enormous talent, in no small part because of immigration. We have incredible resources. And we have the commitment and the capacity to do virtually anything. Within the next 10 years or so, you'll be flying at 22,000 miles subsonically per hour. The changes that are taking place in digitalization and artificial intelligence, I need not tell some of the people, are mind-blowing. So one of the reasons I picked cancer was not just my son, but once we make the progress I predict you will be able to make in the next 5 years, I believe we regenerate a new sense of optimism and commitment in this country. Your children are going to see more progress in the next 15 years than we saw in the last 75 years. But every single day, guys and ladies, millions of people are praying that we succeed, praying for hope, for time, not someday, but now. Those of you who are clinicians, how many times you've had a patient look at you lying on a bed and say, "Doc, can you give me just 2 more weeks? I want to walk her down the aisle, Doc. Just 2 more weeks. Can you give me another month? He's graduating. He's graduating. My daughter's about to deliver her first grandchild in the family. God, Doc, let me see it. Please let me be there to see it." They're not asking to live. They're not asking to be cured. They're asking for one more moment. And it matters. It matters a lot. Every damn moment counts. And every moment we delay matters. I recently spoke to about 4,000 people at Rice University at the Baker Institute, almost to the day that John Kennedy stood there and announced the moonshot at that very space. In describing sending humankind to the moon, he talked about the commitment of a nation. A nation, he said, that was, quote, unwilling to postpone the effort. Unwilling to postpone. In our collective fight against cancer, we have to be unwilling to postpone a day, a week, a month. If there wasn't one single new discovery by collaborating, by changing the structure that existed in '71 to meet the capacities of 2016, you could save a hell of a lot more lives. Seems to me that's why you're all here. Not just for cancer, other diseases as well. I'm speaking only of cancer. So let me end where I should have begun, by thanking you. There's more collective gray matter in this auditorium than probably any other place assembled in the world. You are an incredible group of women and men with enormous, enormous potential. And the whole world's looking to you. Not just the United States, the whole world's looking to you. So I thank you for what you've done. I thank you for your dedication, for the tens of thousands of hours you put in getting the education and the work you've done. Because I'm convinced, I'm absolutely convinced, that when we set our mind to something that's in our grasp, there's nothing that can stop us. So thank you in advance. Thank you all. May God bless you, and may God protect our troops. Thank you very much.